I'm Dan Hamilton with the American College of Surgeons Division of Integrated Communications. Today we're hearing from Dr. Julie Conyers. Dr. Conyers is a general surgeon in Ketchikan, Alaska, and she's going to be discussing her experience as a rural surgeon during the COVID-19 pandemic. Dr. Conyers, thank you for taking the time to share your thoughts.
Well, thank you for inviting me. First, I thought I'd tell you a little bit about our setting. So I work in a 25-bed critical access hospital in Ketchikan, Alaska, which is within an archipelago of over 1,100 islands, and we have no connecting roads. We're part of a 10 hospital system that is based mainly in Washington, but we're the only hospital that's in Alaska. Our island has approximately 16,000 residents, but we probably serve another 15,000, and some of them are in very remote locations on other islands. We are 670 miles north of Seattle and 780 miles south of Anchorage. So that gives you a little bit of idea of what our geography is like, where we practice.
Can you also talk so far what your experience has been with COVID-19?
With COVID. So we initially had quite a few cases, probably from traveling. And currently we have 14 documented cases on the island, but we have been flat for approximately the last week or so. We have 2 patients currently that are in our isolation unit, but our testing takes anywhere from 5 to 7 days because specimens have to be shipped via Alaskan Airlines up to Fairbanks. So we're still waiting for the point of care testing.
And on that note, can you talk about some of the challenges specific to your community and also some of the strengths in dealing with COVID-19?
Well, even in the best of times, our supply chain, as you could imagine, is challenging. So things reach us by barge twice a week or by typically Alaskan Airlines cargo, which is now greatly reduced. So we do have supply chain challenges, even when we're not in the midst of a pandemic. We're part of a system, which is a blessing and a curse. So some of the challenges is that system guidelines may not always pertain to us, but we have the strength of the system, which includes things like an electronic health record. We're now getting our video visits, our phone visits. So much of that is greatly appreciated. We are one strength, we're geographically isolated, and Alaskans that live on remote islands, isolation is nothing new to them. So we also may have the purse of the larger system, but that's unclear. So our revenue actually goes into the system revenue. Some of our great strengths is that we actually have our core medical staff is very strong, but on the other side of that, most of our emergency room physicians are transient. They fly in for their shifts, and same with the hospitalists. And many of them have canceled during this pandemic for obvious reasons. We can't quarantine people who travel because we need our healthcare workers to work. So we've got, in the midst of that, we have a leadership change where we've had an interim CEO who's been wonderful, but our new one starts on Monday. So those have been our local challenges. But I would say one of our biggest challenges is our supply chain.
And then hospitals all over the country have been ramping up with the expected surge of COVID-19. So can you talk about some of the specifics that your hospital's been doing to prepare?
The system was actually fairly slow, and we, through our medical staff bylaws and our medical executive committee, were able to organize ourselves very quickly. So within the space of days, we had set up tents outside the emergency room for testing. We established EMTALA waivers. We set up an isolation unit of 9 beds, all of this negative flow. And we also, through our MEC, set up this physician task force for the COVID-19, and we also were able to pass some of the policies through our MEC to be able to establish some sort of a structure in preparation for this. We're now starting to, the incident command was more of a committee where as physicians we're going to kind of help with that. I think surgeons are natural leaders in incident command because of our training with trauma. If you've heard of Ketchikan, one reason could be because we've had several plane crashes around here. So we have been in incident command positions, but they're usually short-lived. This is like over the period of 4 to 6 weeks. So those are some of the things. Our challenges are supplies, which is everybody's challenge. For instance, everybody comes in the hospital supposed to wear a medical mask. Well, we just really don't have enough of those. Rainy day quilters. We have a large community of quilters, so they've been making our masks. We're also making Tyvek isolation gowns because we're running short of those. So these are reusable. So it's been amazing how the community has come together to help support us through this pandemic.
Yeah. And the COVID-19 situation has been very fast moving and changing. So how have you been obtaining information and adapting as things change?
Well, the American College of Surgeons has really risen to the occasion for this. Our communities are invaluable. I can't even begin to describe how invaluable that's been. So it has been the information highway. Tyler Hughes and his team have just been working endlessly. You can tell the COVID newsletter has been invaluable. And the journals have taken down their paywalls, so we have access to those. I'm part of a physician executive MBA community. So there's been a lot of information coming from that, particularly from a leadership perspective. So it's been so many different ways that we've been getting information. In fact, there's so many avenues that you can access it. It's almost having to have that filter. Now, the college COVID newsletter is very helpful because it does supply that filter for some of the information that could be more important to us as surgeons and in the community.
Do you have any specific lessons learned in your experience in Ketchikan so far that you'd like to share with other surgeons?
Well, some of the lessons is just to encourage surgeons to be your local leader. I think particularly in a crisis like that, I think many surgeons are trained in crisis training just by virtue of our trauma background. Know your medical staff bylaws, and you may need to take advantage of those if you need to move fast in a crisis like this. I feel like the COVID preparedness needs to be physician-led, and administrators really provide a supportive role for that. And that's, I think, one of the most important lessons. Also, as a physician, I feel like I have to be sensitive to our administrators as they are also working within a system and what their pressures are. So I think also we need to start looking ahead. Rural hospitals, many of them have been on the cusp of financial crisis. Some of them don't have cash on hand for more than 30 days, and they're operating with 1% to 2% razor thin profit margins. So I think there'll be a lot of thought after this regarding our fragile healthcare system. But I think the biggest lesson is, as a surgeon in your community, becoming a leader.
Yeah, certainly.
And how you can impact your community and your hospital.
Yeah. Well, thank you. And do you have any final thoughts you'd like to share with other rural surgeons?
Well, to my fellow rurals, I'm very grateful for our community that we share. and continue sharing your stories because we're all learning from each other. But we are working in low resource environments. And I think many of us will be spared from big COVID surges, but we're ready and now we're waiting.
All right, well, thank you for your willingness to share your experiences. This was great.
Thank you.
Thank you, and be well.
Okay, you too. Bye-bye.